Today we're diving into a rare but increasingly common injury among bodybuilders, the rupture of the pectoralis major muscle or PM rupture. Over the past few decades, this injury has become more frequent, especially in those who participate in weightlifting and contact sports. We'll explore what causes this injury, how it's managed, and the role anabolic steroids might play in both the injury and recovery process. Let's start by understanding what makes the pectoralis major muscle so important for athletes and why its rupture can be such a significant setback. Pectoralis major is a broad, fan-shaped muscle that covers much of the upper chest. It plays a crucial role in moving the arm, especially in actions like adduction, internal rotation, and flexion. For athletes, especially bodybuilders, this muscle is not only essential for strength but also for the cosmetic appearance of the chest. When the PM ruptures, it can lead to both functional limitations and visible deformity, making it a significant concern for those who rely on their upper body strength and appearance. PM ruptures most often occur during weightlifting, particularly the bench press. The injury typically happens when the arm is extended and abducted, placing the tendon under maximum tension. If the muscle is fatigued or the weight shifts unexpectedly, the tendon can tear, leading to immediate pain and loss of function. In the case series we're discussing, all 6 patients experienced their injuries during bench press exercises, highlighting the risks associated with heavy lifting and improper technique. A PM rupture occurs, the symptoms are usually immediate and dramatic. Patients often report a sudden sharp pain in the chest, followed by an inability to continue training. Visible signs include deformity of the anterior axillary fold, bruising over the chest wall, and a noticeable asymmetry when moving the arm. Diagnosis typically involves a physical exam, radiographs to rule out bone involvement, and MRI to confirm the extent and location of the tear. This study, 6 male bodybuilders aged 21 to 40 were examined after sustaining PM ruptures during weightlifting. The injuries were split evenly between the dominant and non-dominant arms, suggesting that limb dominance may not play a significant role in risk. None of the patients had a history of similar injuries or prior interventions, and all were injured while performing heavy bench presses without an assistant present. Half of the patients in the case series reported using anabolic steroids at the time of their injury. These substances are often used by athletes to rapidly increase muscle mass and strength. However, their use is controversial as they may contribute to tendon stiffness and increase the risk of rupture. The study found that those using steroids were generally younger and lifted heavier weights than non-users, raising questions about the relationship between steroid use, muscle strength, and tendon vulnerability. Primary mechanism for PM rupture is excessive muscle tension during bench press, especially when the arm is abducted and externally rotated. Muscle fatigue or a sudden shift in weight can cause the tendon to fail. The study notes that both dominant and non-dominant arms were affected, and the injuries occurred with very heavy weights, particularly among steroid users. This suggests that the risk is more related to load and technique than to limb dominance. PM injuries are classified by their location and severity. The Taichen system divides them into sprains, partial tears, and complete tears, with further subdivisions based on where the tear occurs. In this case series, most patients had complete ruptures at the tendon's insertion onto the humerus, while one had a rupture at the musculotendinous junction. Understanding the type and location of the injury is crucial for determining the best treatment approach. Treatment options for PM rupture include both surgical and non-surgical approaches. Non-surgical management is typically reserved for partial tears or low-demand patients. However, for complete ruptures, especially in athletes, surgery is recommended to restore strength, function, and cosmetic appearance. The surgical method often involves reattaching the tendon to the bone using suture anchors or direct repair, depending on the injury's location. This study, all patients with complete ruptures underwent surgical repair. 5 had their tendons reattached to the humerus using suture anchors, while 1 patient with a musculotendinous junction rupture received end-to-end sutures. All surgeries were performed under general anesthesia using a standard deltoepidural approach, which allows for optimal visualization and access to the injury site. Post-surgery, all patients followed a standardized rehabilitation protocol. The arm was immobilized in abduction for 2 weeks, followed by passive and active range of motion exercises starting in the 3rd week. Physical therapy was supervised to ensure proper healing and gradual return of strength and function. By the 6th week, most patients had regained full range of motion, setting the stage for a safe return to training. Results were impressive. All patients achieved excellent outcomes according to the BAC criteria, with full range of shoulder motion, nearly normal muscle strength, and restored cosmetic appearance. On average, patients returned to full activity within 5.4 months after surgery. There were no postoperative complications and none required a second surgery. These findings highlight the effectiveness of surgical repair for PM ruptures in athletes. Interestingly, the continued use of anabolic steroids during the recovery period did not negatively affect the time to recovery or the level of functional improvement. Both steroid users and non-users regained similar levels of strength and function. However, it's important to note that 1 patient who continued steroid use died of a myocardial infarction within a year, underscoring the potential long-term risks of these substances. After surgery, patients were able to return to heavy lifting, though their bench press weights were slightly lower than pre-injury levels. On average, steroid users regained 86% of their previous maximum, while non-users regained 81%. Isokinetic testing showed only a 9% decrease in strength with no significant difference between the 2 groups. This suggests that surgical repair can restore most of the lost strength, regardless of steroid use. Timing of surgery, whether performed acutely or after a delay, remains a topic of debate. In this study, both acute and chronic repairs led to excellent outcomes, with no significant difference in recovery time or function. However, chronic repairs can be more technically challenging, so early intervention is generally preferred when possible. While anabolic steroids may help athletes build muscle quickly, they come with significant risks. Long-term use has been linked to irreversible cardiovascular disease and may contribute to tendon injuries by making tendons stiffer and less elastic. The study also notes that steroid users tend to lift heavier weights, which could further increase the risk of rupture. These findings highlight the need for caution and awareness among athletes considering steroid use. For bodybuilders, the cosmetic appearance of the chest is just as important as functional strength. PM rupture disrupts the anterior axillary fold, leading to visible deformity. Surgical repair not only restores strength but also helps regain the normal contour of the chest, which is a key concern for athletes and those in physically demanding professions. Preventing PM rupture involves proper training techniques, avoiding excessive loads, and ensuring adequate rest and recovery. Using spotters during heavy lifts and focusing on balanced muscle development can also reduce risk. For those considering anabolic steroids, it's crucial to weigh the potential performance benefits against the serious health and injury risks. This case series highlights several important points. PM rupture is becoming more common among bodybuilders, especially those using anabolic steroids. Surgical repair offers excellent outcomes, with most patients regaining full function and appearance. Steroid use may increase the risk of injury but does not seem to hinder recovery if surgery is performed. However, the long-term health risks of steroids remain a serious concern. For athletes, especially those in bodybuilding and strength sports, understanding the risks of PM rupture and the impact of anabolic steroids is crucial. While surgical repair can restore function and appearance, prevention is always better than cure. Athletes should prioritize safe training practices and be mindful of the potential consequences of performance-enhancing substances. Summary: Pectoralis major rupture is a serious but treatable injury that's becoming more common among bodybuilders. Surgical repair provides excellent results, but the risks associated with anabolic steroid use, both for injury and long-term health, should not be underestimated. By focusing on safe training, proper technique, and informed choices, athletes can protect their health and performance for the long run.